You've been tired for months. Your digestion is unpredictable. You've done the blood work, you've taken the supplements, you've tried sleeping more, and nothing is moving the needle. What if the problem isn't that your body is failing you? What if something is living inside your gut right now, quietly consuming the very nutrients you're trying to replace? I want to tell you about a patient I'll call Margaret. She was 67 when she first came to see me, but honestly, the story I'm about to describe could belong to any woman between 35 and 70. Margaret had done everything right. She had seen 3 different physicians over 2 years. Her thyroid had been tested, her iron had been checked. She had been given supplements, a melatonin prescription, advice to exercise more. She had followed all of it, and she came to me still exhausted. Not the kind of tired that a good weekend fixes. The kind that is sitting on your chest when you open your eyes in the morning. The kind that makes you cancel things, avoid things, wonder quietly whether this is just what the rest of your life is going to feel like. Sound familiar? Here's what bothered me about Margaret's case. Every test that had been run came back reasonable. Not alarming, not optimal either. Her iron was low normal. Her B12 had drifted down slightly. Her sleep hadn't improved despite the melatonin. And when I sat with her and asked her to walk me through everything, not just the big symptoms, but the small, embarrassing, easy-to-dismiss ones, a pattern emerged that nobody had looked at as a whole. She had developed a cycling digestive pattern, bloating for a few days, then fine for a week, then back again. She had cravings for bread and sugar that had appeared out of nowhere, and she mentioned, almost as an aside, something she had never told any of her other doctors: a recurring itch, mostly at night. She had assumed it was dry skin. I asked her one question that nobody had asked yet. When had anyone last looked at what was actually living inside her gut? Nobody had. I'm Dr. Nora Khalil, and for 12 years I've worked with women, mostly in their 40s, 50s, and 60s, who come to me with symptoms that have been treated but never resolved. This channel exists because I believe your body is sending you comprehensible signals, and I believe you are far more capable of understanding those signals than most of the healthcare system gives you credit for. If this is your first time here, please subscribe before we go further. Not as a formality, but because what I'm covering today connects directly to other videos in this series, and the pieces matter more together than they do alone. The button is below. Come back, now. Let's talk about what was actually happening inside Margaret's gut, and why nobody caught it for 2 years. I want to give you a name for what I see happening in cases like Margaret's, because once you have the name, you'll start recognizing the pattern everywhere. I call it the silent tenant system. Here's the idea. Imagine your gut as a very large, very active piece of real estate. The small intestine alone, if you flattened it out completely, would cover roughly the size of a tennis court. It is covered in millions of tiny finger-like projections called villi, which just means tiny hairs, and those projections are doing one job all day, every day, absorbing nutrients from everything you eat and passing them into your bloodstream. Now imagine that someone moves into that real estate without asking. They don't announce themselves. They don't cause an immediate crisis. They just settle in. And quietly, steadily, they start taking a cut of everything that passes through. Your iron, your B12, your magnesium, your energy. Day after day before you ever see it. That's the silent tenant system. The tenant, in this case, an intestinal parasite, doesn't need to make you violently sick to cause real damage. In fact, many of the most common intestinal parasites in adults do their work so quietly that the only signs are the things you stop having enough of. Energy, mental clarity, restful sleep, stable iron levels. And here's the part that trips everyone up, including many physicians. The standard tests most doctors run when you report fatigue and digestive symptoms are not designed to find this tenant. A routine stool culture, which is what gets ordered most often, looks for bacteria, Salmonella, E. coli. It does not look for parasites. It cannot look for parasites. That requires a completely different test, which means the tenant can be in residence for months, sometimes years, while every routine panel says, nothing found. That gap, between the symptom and the right question is what I want to walk you through today. Let's start with the basics, because most people have a mental image of intestinal parasites that belongs in a documentary about a remote jungle village, not in a 45-year-old woman in New Jersey who drinks filtered water and eats mostly organic. That image is wrong. And it's part of why this goes undetected for so long. The World Health Organization estimates that more than 1.5 billion people carry soil-transmitted helminths, that's the scientific name for intestinal worms, at any given time. That number doesn't even include protozoal infections, which are caused by microscopic single-celled organisms rather than worms. Giardia lamblia, commonly just called Giardia, is the most commonly diagnosed intestinal parasite in the United States. It is found in water systems and food supplies across North America every year, including in places with modern infrastructure and reliable sanitation. I'm not telling you this to alarm you. I'm telling you because the assumption that this couldn't happen to me, that your zip code, your diet, your lifestyle rules it out, may be the exact reason why the right question never gets asked. So what are the organisms we're actually talking about? There are two main categories. The first is helminths, worms. This group includes roundworms, hookworms, tapeworms, and pinworms. They are visible to the naked eye at maturity, though you would almost never see them without looking specifically. They attach to the intestinal wall. Some, like hookworms, feed directly on blood. A moderate hookworm burden can cause daily blood loss significant enough to produce iron deficiency anemia that simply does not respond to oral iron supplements. Not because you're taking the wrong supplement, because you have a slow, hidden bleed happening inside your gut every single day. Tapeworms are particularly efficient at stealing vitamin B12. A patient can have borderline low B12, take supplements diligently, see modest improvement, and never fully stabilize, because what's absorbing the B12 first isn't them, it's the tenant. The second category is protozoa, microscopic organisms. Giardia is the most well-known in this group. Giardia doesn't burrow into the intestinal wall the way worms do. It coats it. Picture the inside of your small intestine, all those nutrient-absorbing villi. Now picture a film spreading across the surface, like plastic wrap laid over a window. That's roughly what a heavy Giardia infestation does. It creates a physical barrier between the food passing through your gut and the villi trying to absorb it. The result is something called malabsorption, meaning nutrients pass through your gut without actually entering your body. Fats. Fat-soluble vitamins like D, E, and K. Carbohydrates. All of it flowing past a surface that can't properly reach it. You can eat a perfect diet and still be malnourished if something is standing between your gut and what you're eating. Giardia also disrupts something called tight junction proteins. These are the microscopic seals between individual intestinal cells. Think of them as the grout between tiles. Their job is to keep the contents of your gut inside your gut and only allow properly absorbed nutrients to cross into the bloodstream. When Giardia weakens those seals, undigested particles can slip through. The immune system inside the gut wall detects them as foreign and activates. What that activation looks like from the outside is not a dramatic immune response. It looks like low-grade background inflammation, the kind that doesn't show up as a dramatic spike on a blood test, the kind that contributes, quietly, over months, to fatigue, cognitive fog, joint discomfort, and an immune system that starts feeling like it's always slightly overwhelmed. Here is what bothers me most about how this plays out in standard clinical practice. When a physician orders a stool test for a patient reporting fatigue and digestive complaints, what they typically order is a stool culture. A stool culture is designed to detect bacterial infections. It looks for organisms like Salmonella, E. coli, and Campylobacter. It does not and cannot detect parasitic eggs, cysts, trophozoites, immature parasite forms, or larvae. To detect intestinal parasites, you need a stool ova and parasite examination. Ova and parasite, or O and P, is a different test entirely, and even that test has limitations. Parasites don't shed eggs or cysts continuously. They do so in cycles, tied to their own reproduction schedules. A single stool sample collected on a single day can come back negative even in an active, established infection. Most clinical guidelines for suspected parasitic infection recommend collecting at least 2 to 3 separate stool samples on different days. Giardia and Cryptosporidium, another common protozoa, have their own antigen-specific tests that are significantly more sensitive than the standard O and P exam. These tests have to be requested specifically. They are not included in a standard stool panel. So here's the chain of events that leads to years of misdiagnosis. A woman in her 40s reports fatigue, cycling digestive symptoms, and nutrient levels that aren't improving with supplementation. Her physician orders blood work and a stool culture. Both come back without red flags. The stool culture is negative, for bacteria, which is what it was looking for. The B12 is low normal, so a supplement is recommended. The fatigue is attributed to stress, age, possibly mild depression. The conversation moves on. The right test was never ordered. Not out of negligence, not because the physician didn't care, but because in the mental framework of most Western clinicians, intestinal parasites belong to a different category of patient, someone who has recently traveled internationally, someone living in a low-resource setting, someone presenting with acute, dramatic symptoms. Not a 45-year-old woman who eats well and drinks filtered water and is just chronically, unrelentingly tired. That assumption has cost people months, sometimes years. The right answer wasn't hidden. The right question just never got asked. This is the part where I want to slow down, because it's where most people have their first real moment of recognition. I'm going to describe 5 signals, not because all 5 appearing together is proof of a parasitic infection, it isn't, but because each of them, especially when they cluster, when they cycle on their own schedule, or when they persist despite treating other causes, deserves a closer look. Signal 1. Fatigue that doesn't respond to sleep. This is a specific kind of tiredness. It is not the exhaustion that lifts after a good night's rest. It is the kind that is present in the morning as reliably as it was the night before. Patients describe it as heaviness, like something is consuming their energy before they even have a chance to use it. When fatigue like this coexists with slightly low iron or B12 that doesn't improve predictably with supplementation, I want to know what's happening in the gut before I accept any other explanation. Signal 2. Digestive cycling. Constipation for a few days, then loose stools, then a week of feeling normal, then back again. People adapt to this pattern. They adjust their diet, they add probiotics. Some of this helps temporarily, but the cycling continues because it's running on the organism's biological rhythm, not the body's. Signal 3. Sudden, intense cravings for sugar and refined carbohydrates. This one surprises people. They expect me to blame stress or blood sugar. Those are real causes, but certain helminths rely heavily on glucose for energy. They are also capable of interfering with the gut-brain signaling that regulates appetite. When a woman in her 40s reports a sudden, unexplained increase in carbohydrate cravings alongside fatigue and digestive cycling, with no change in her overall diet or stress level, that combination gets my attention. Signal 4. Skin changes without a clear cause. Eczema-like patches, hives that come and go, adult acne appearing for the first time in years, unexplained itching on the limbs or trunk. The gut and the skin communicate through a shared immune signaling network that most people don't realize exists. When the gut's mucosal barrier is compromised, which is exactly what certain parasites cause, the immune response can manifest on the skin in ways that look completely unrelated to digestion. A dermatologist treats the skin. Nobody asks about the gut. The skin keeps flaring. Signal 5. Nocturnal perianal itching. This is the one patients almost never mention unless asked directly. An itch around the rectal area that comes at night and gets chalked up to hemorrhoids, diet, or dry skin. This is the defining symptom of pinworm infection. Female pinworms migrate to the perianal skin at night to deposit eggs. The itch is the body's response to that migration. Pinworm infection is remarkably common, and it spreads easily in households with school-aged children or grandchildren. Your body isn't speaking quietly, we just haven't been listening in the right direction. Now here's what I want you to hold on to. These 5 signals look completely unrelated on the surface. Fatigue goes to one doctor, skin goes to another, digestion gets an IBS label. Each one gets managed separately. Nobody steps back to ask what might be connecting them. The connection, in cases like Margaret's, is something that simply wasn't looked for. There is a cycle I want to explain because it's the reason these symptoms compound over time instead of staying stable. Parasites deplete nutrients. Nutritional depletion weakens the immune system's ability to fight back. A weakened immune response allows parasites to persist longer and in greater numbers. More parasites generate more inflammation. More inflammation damages the gut lining. A damaged gut lining absorbs less. Less absorption produces deeper deficiencies. The body keeps sending signals: fatigue, skin changes, mood shifts, broken sleep. Each signal gets treated in isolation. The fatigue gets an iron supplement. The skin gets a topical cream. The mood gets a referral. The loop continues. This is the cycle, and it doesn't break until someone looks for the tenant. Here is the shift I want you to make. And once you make it, I don't think you'll see this the same way again. We have been trained by how medicine is organized, by how appointments work, by how specialists are divided, to think about the body as a collection of separate departments. Fatigue is an energy problem. Digestion is a gut problem. Skin is a dermatology problem. Mood is a mental health problem. But your body doesn't operate in departments. It operates as a territory. And if something is living in that territory that doesn't belong there, quietly competing for nutrients, quietly inflaming the gut wall, quietly disrupting the signals between your gut and your brain, you cannot solve the downstream problems by treating them one department at a time. You keep patching holes in a boat without asking what's making the holes. The reframe I want you to leave with is this: persistent symptoms that don't respond to treatment are not a sign that your body is broken. They are a sign that the right question hasn't been asked yet. Margaret recovered. Her iron normalized, her sleep changed, the cycling stopped. Not overnight, because real gut healing takes time and requires proper treatment followed by deliberate rebuilding of the gut environment. But she recovered, and she told me at a follow-up appointment that for 2 years she had been told the problem was her age. She was 67 when we found the answer. She told me, "I have at least 25 more years ahead of me. I wasn't willing to spend them this way." That's what stays with me. The body doesn't fail quietly without reason. It sends signals. The question is whether we're asking for the test that can actually hear them. Let me be very concrete here, because I know some of you are going to walk away from this video and not know what to do next. I don't want that. If you recognize several of the following: chronic fatigue that sleep doesn't fix, digestive cycling on its own schedule, nutritional levels that don't improve with supplementation, unexplained skin changes, or nocturnal itching, bring this cluster of symptoms to your physician directly. Don't wait for it to be raised. Name it. Ask specifically for a comprehensive stool, ova and parasite, O&P examination, collected on 2 to 3 separate days, not just one sample. A Giardia antigen test, requested separately because the standard O&P exam misses Giardia in a meaningful percentage of cases. A cryptosporidium antigen test if you've had any recent gastrointestinal illness that seemed to resolve but left you with lingering symptoms. I want to say something directly about this because I know many of you hesitate to advocate for yourselves in a medical appointment. You are not being difficult when you ask for a specific test. You are giving your physician relevant clinical information, a cluster of symptoms that points toward a particular kind of investigation, and you are asking for the tool that can address it. That's not overstepping. That's participating in your own care. There is a real difference between those two things, and I need you to feel that difference. I can't tell you exactly what's happening in your body. Only your doctor can do that. But I can tell you what's commonly happening in bodies like yours, so that when you do have that conversation, you're not starting from zero. Confirmed parasitic infection, especially with helminths, typically requires pharmaceutical treatment. There are effective, well-tolerated medications, albendazole and mebendazole for worms, metronidazole for certain protozoa including Giardia. These work. The natural approaches I'm going to discuss in a moment are supportive and preventive. I believe in them. But I want to be direct. If you have a confirmed infection, please treat it with your physician. Don't substitute herbs for a diagnosis that needs a prescription. Step 4. Support your gut environment, what the evidence actually says. Now, for the supportive side. Raw garlic contains a compound called allicin. It forms when you crush or chop raw garlic, and multiple lab studies have shown it has activity against Giardia and certain other intestinal organisms. For this to be useful, the garlic needs to be raw and eaten relatively soon after preparation. Cooked garlic produces very little allicin. Half a clove to a full clove of raw garlic, chopped and rested for a few minutes before adding to food, is a practical daily addition. Pumpkin seeds have a long history across many traditional food cultures for gut health, and there is now some research explaining why. The active compound is cucurbitacin, a substance that appears to temporarily impair certain intestinal worms' ability to grip the intestinal wall. The amounts used in traditional preparations are not small. A significant handful of raw, unsalted seeds used consistently over weeks, not a sprinkle. Clove is the one I find genuinely interesting, specifically because its primary bioactive compound, eugenol, appears to have activity against the early reproductive forms of certain parasites, including eggs and larvae. Most antiparasitic approaches, conventional and natural, target adult organisms. Clove is one of the few natural compounds with studied activity against the earlier stages. The research is still early, and I want to be transparent about that, but the mechanism is plausible and worth incorporating. Ginger works on several levels simultaneously. It has documented antimicrobial and anti-inflammatory properties. It improves gut motility, meaning it helps move things through your digestive tract at a healthy pace. And it supports the mucosal lining of the gut, the very lining that parasitic infection tends to compromise. Ginger tea, ginger in cooking, or a standardized ginger supplement all have well-established safety profiles, even for daily use in adults over 40. These 4 are not treatments. They are environmental support, things that make the gut a less hospitable place for organisms that don't belong there, while supporting the immune function and structural integrity of the gut wall itself. Dietary fiber deserves its own mention. Soluble fiber, from oats, flaxseed, cooked lentils, and beans, is what I describe to patients as the unglamorous support structure of everything the gut does. It feeds beneficial bacteria, supports regular transit, and binds certain waste products for elimination. When the gut is actively working to clear an unwanted organism or recovering from having hosted one, fiber is the foundation that makes the rest possible. Most women in their 40s and 50s consume far less fiber than their gut actually needs. Step 5. Know when this requires urgent medical attention. Some symptoms mean you don't wait. You call your doctor this week. Unintentional weight loss alongside fatigue and digestive symptoms. Visible blood in your stool. Stools that are consistently pale, greasy, or foul-smelling in a way that's new. Fatigue severe enough to meaningfully interfere with daily function. Things you could do a year ago that you genuinely cannot manage now. Recent travel to areas with less reliable water treatment, combined with persistent post-illness symptoms. Any immunocompromising condition or medication that suppresses your immune system. These lower the threshold for investigation. Don't manage them at home. If you test and come back negative, that does not end the inquiry. A single negative result narrows probability. It doesn't eliminate it. Parasites shed eggs and cysts in cycles. One sample on one day is not a definitive answer. Keep the conversation open with your physician. Ask about repeat testing if symptoms persist. Here is what I keep coming back to, after 12 years of conversations like the one I had with Margaret. The body does not send ambiguous signals, it sends specific ones. Fatigue that doesn't respond to sleep is a specific signal. Digestive symptoms that cycle on their own schedule are a specific signal. Nutritional levels that don't improve with supplementation are a specific signal. The problem isn't that your body is unclear. The problem is that we have built a medical system organized around separate departments, and some explanations live in the space between departments, where nobody is automatically looking. What lives in that space, sometimes, is a silent tenant. one that no stool culture will find, one that no iron supplement will fix, one that has been quietly running the depletion loop for months while every test says, nothing found. Margaret's story didn't end at 67. She recovered, she rebuilt, and she told me something I think about every time I see a new patient with a folder full of normal results and a body that is clearly not normal. She said, I just needed someone to ask the right question. Your symptoms are not a personality flaw, a sign of aging, or something to manage forever. They are a map, and maps lead somewhere if you know how to read them. If this conversation about the gut's inner ecology has stayed with you, there's a connected episode I'd suggest watching next, because once you understand how a silent tenant disrupts the gut's bacterial environment, the question of how to rebuild that bacterial community becomes just as important as removing the problem. That's what the next video addresses directly. The link is in the description. And if you haven't subscribed yet, this channel is a series, not a collection of isolated videos. What I covered today connects forward and backward to other pieces, and the connections are where the insight lives. Subscribe below. I'll see you in the next one. Take care of yourself.